Cognitive behavioral therapy is one of the most effective treatments we have for insomnia. Let's take a look at what it is and how it works. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Cognitive behavioral therapy for insomnia is a very structured type of therapy that works really well for people with chronic insomnia. And it's one of those things that people hear about and they think, oh, I've already tried that, or that's not going to work for me, or that's way too simple. But actually, what is beautiful about it is that it is so simple, but it's incredibly effective. In fact, it's so effective that the NIH consensus and the American Academy of Sleep Medicine recommend CBTi, or cognitive behavioral therapy for insomnia, as a first-line treatment for insomnia, meaning the first thing to try before you even do medications or other things. And it's really interesting because I get a lot of people coming to me for help with insomnia and they say they've tried everything, and I'll ask them, well, have you done CBTi? And more often than not, they'll say no. So I thought it was really important to make this video and provide some information about what CBTi is. At its core, CBTi addresses the behaviors, the thoughts, the associations that feed into the vicious cycle of insomnia. Usually the longer that people have sleep issues, the more they're actively trying to sleep, and they start developing anxiety and a lot of stress around sleep. So CBTi is great for people who are struggling with those particular types of issues. Some of the associations that are addressed in CBTi are the association of the bed and the bedroom with the hyperarousal response. Many people, after they've had long-term issues with insomnia, they start to associate the bed and the bedroom and even bedtime with stress and being anxious. The longer a person has issues with sleep, the more negative thoughts they start to associate with sleep. Some of these thoughts may include things like, I'm going to be so exhausted tomorrow, I don't know how I'm going to get through the day, or I'm so frustrated, I wish I could sleep. And these kinds of thoughts can increase the activity of the sympathetic nervous system. That's the fight, flight, or freeze response. So you can see how activating the sympathetic nervous system, getting into this revved up state, is going to prevent you from falling asleep. So a very important component of CBTi is learning how to address those negative thoughts and then calm your nervous system so that you're in a better state to actually be able to fall asleep and stay asleep. CBTi is more than just the standard sleep recommendations that you may have seen, like cutting out caffeine and not watching TV and things like that. And for people with chronic insomnia, those types of recommendations can sometimes be even more frustrating because many people feel like they've tried that, been there, done that, and it hasn't worked. So CBTi is much more than those basic recommendations. One of the components of CBTi is psychoeducation about sleep. So understanding the physiology and the mechanics of sleep. Another aspect of CBTi is stimulus control. Part of stimulus control is kind of addressing the relationship that you have with your sleeping environment and your bed and your bedroom and so forth. Relaxation training is another component of CBTi, and this may involve progressive muscle relaxation or breathing techniques or certain types of meditation, all of which help to reduce that sympathetic nervous system response and activate the parasympathetic response, which is the rest and digest part of the nervous system. Sleep restriction is another aspect of CBTi, which involves restricting the amount of time in bed closer to the amount of time you're actually sleeping in order to increase sleep efficiency. And then relapse prevention is another aspect of CBTi. So essentially coming up with a maintenance plan so that you know exactly what to do if you slide backwards. And it's totally normal to have times come up where you don't sleep as well. We all experience those. So part of CBTi is learning what to do in those situations. All of this probably sounds very simple, but CBTi does work. And it also takes multiple changes over time. There's no one quick fix. Where does one do CBTi? Well, CBTi can be done one-on-one with a trained behavioral sleep specialist. Locally, you can ask your primary care physician for a referral. You can also look at the Society of Behavioral Sleep Medicine website for a list of practitioners in your area. CBTi can also be done in a group setting, so many hospitals and clinics do offer CBTi groups. As far as apps, I really like the CBTi Coach app, which is free. It was developed by the VA here in the US for veterans with sleep issues, but it is relevant and usable by anybody. There are also different online programs. These programs are available around the world. I'll be launching an online sleep program next year, so stay tuned. My program is not specifically a CBTi program, but it will incorporate elements of CBTi. So you can look out for more information on that. I've also got lots of great information in my free sleep guide. The sleep guide is available on my website at IntraBalance.com/sleep guide. The link to the guide is also available in the video description.